Another measure he implemented was to group staff in buildings into departments. Patients were grouped according to their illnesses. He placed surgery patients in the building where the operating room was. He also instituted modern techniques for examining specimens and tissue samples. This gave doctors as much information as possible about a patient before starting treatment. He raised quality even higher by bringing in an interracial staff of 20 of the city's top doctors to serve as consultants without salary. This offered black doctors their first opportunity to work in a hospital. Dr. Williams also created the first internship program to train doctors at Freedman's, and this strengthened his staff. His innovation again led to the foundation for black medical school graduates to receive the necessary training.
He was aware of the problem of access for black physicians, because there were some black physicians even during that period, and they had a difficult time practicing medicine because they did not have access to the facilities to practice their craft. Many physicians could not get on the staffs at various hospitals, and indeed Dr. Williams experienced this himself.
Dr. Williams realized black nurses needed a facility for training and established a training school at Freedman's. Before Dr. Williams took over, the hospital served only low-income black patients. He wanted to attract the black middle class to strengthen Freedman's image. By inviting the public to watch him and other surgeons perform demonstration operations for students, gradually, blacks with higher incomes gained confidence in Freedman's and used its services. There were other periods when Dr. Williams got overwhelmed by the burdens of organizing the hospital. During one of these times, he visited black leader Frederick Douglass for advice. Douglass was his mother's cousin. "My boy, you say you see what ought to be done. Well, hoping will do no good, now or any time. There is only one way you can succeed, Dan, and this is to override the obstacles in your way by the power that is within you. My boy, do what you hope to do." Frederick Douglass. In classes that Dr. Williams taught, medical students and doctors were amazed at his skill. Dr. Williams' reputation stretched throughout the city, and even white doctors visited Freedman's to study his methods so they could learn.
Dr. Williams was a trauma surgeon in addition to being a very fine thoracic surgeon. Back in the 1890s, many of the principles of trauma surgery that we take for granted today were not known. Even exploring the abdomen for abdominal injuries was not a basic principle widely accepted in this country. Dr. Williams managed a patient who was stabbed to the thoraco-abdominal area, the back actually, involving both the chest and the abdomen. And he inserted a tube to drain the chest and then opened the abdomen and explored the abdomen. And he found that there was bleeding internally coming from the spleen. The spleen is a solid organ that helps our bodies to prevent infection because it produces those cells that help to fight off infection. And it's an important organ, but one can live without the spleen if it's damaged severely. At this time, Dr. Williams brought the spleen up into the field of operation, looked at it, and saw that he could repair it. And he used sutures to repair the spleen, and then wrapped it in a fatty apron called omentum, and then placed it back into the abdomen. Now, this procedure today is referred to as a splenography. It's very fancy. It basically means repair of the spleen. And it is an accepted principle today. And in fact, most of the injuries to the spleen we would hope we could fix. But that was not an accepted principle back in that time. And so here's a man who actually invented an operation that is quite contemporary today, but was revolutionary at that time.
Although white doctors in the District of Columbia Medical Society often discuss Williams' cases, they never invited him to join or even visit. In response to this, in 1895, he helped form two medical associations for black and white members. One of these organizations was the National Negro Medical Association of Physicians, Surgeons, Dentists, and Pharmacists. This has grown into the National Medical Association.
He had to overcome a lot of obstacles as a black physician at that time to go through what he went through, go through medical school and practice and succeed the way he did. So I think he really was a driving force in the black medical community.
During his years in Washington, Dr. Williams went through rough times away from the hospital. Frederick Douglass died in February 1895. Dr. Henry Palmer, who got him started in medicine, died. His brother Price, a prominent lawyer in Philadelphia, also died. In 1896, at the age of 40, he married Alice Johnson in Washington. After 2 years, the struggle to raise standards in an atmosphere of constant political turmoil had taken its toll on him. By now, he was convinced the federal government was not committed to funding Freedmen's so that it could be a quality facility for blacks. His accomplishment at Freedmen's disturbed some people to the point that they made secret plans to replace him. Dr. Williams was notified that he had to testify before a congressional hearing committee to defend himself against allegations of improper use of hospital funds. At the hearing, he thoroughly reviewed his record and was later cleared of all charges. After 4 years, he had reached his goal to transform the hospital into a quality facility and submitted his resignation.
You heard the terms quality control and quality improvement, and these are buzzwords today. But these were the things that Dr. Williams emphasized back in 1894. That's when he was the surgeon-in-chief at Freedmen's Hospital. So that's tremendous. Over 100 years ago, emphasizing the issues of quality care.
In April 1898, Dr. Williams went back to the same city where he had carved a place for himself in medical history, when he performed the first successful operation on the human heart 5 years earlier. Within months after returning to Chicago, he was called back to Washington to appear before another congressional committee. This time on charges he bought personal items with the hospital's money. Dr. Williams was shocked after he found out that the people he'd worked closely with on his staff, and even helped him to develop their careers, played critical roles in having these charges leveled against him. This betrayal from the people he was a mentor to hurt him deeply. After this, Dr. Williams did not hire an assistant in his office for many years, not even a secretary. The next year after moving back to Chicago, his hopes of starting a family ended when his wife lost the baby and almost died. This prevented her from having children. He suffered another traumatic loss the next year when his mother died.